So, who has the first question or comment? We'll go right there.
Can we have some more light in the room?
Hello. Hi, my name is Jahnavi. I'm a medical doctor, originally from India. First of all, I just wanted to say that this was very educational for me. I didn't realize that Medicare has diversified healthcare when it comes to serving the minorities. And I work at the LA County Hospital of USC, and I had the opportunity to work with the minorities, so I feel very honored to have the experience. My question is, I came across this research article recently, and it was a report about physician salary 2018, and it represented a graph in which different ethnicities' salaries varied, and it differed more when it comes to women. And women of color are the most least paid in the in the medical community. I was very surprised. So I believe this is institutional racism, and I wanted to ask you, what do you think of this situation in the 21st century America? Where is this gonna go?
Well, I don't know how helpful or informative I can be about that. I mean, I think there's no question, but that there continues to be institutional racism, and it doesn't surprise me that women of color in the medical profession or in all of health services are the least well paid of anybody. But I haven't studied that. It's not something that I know a lot about. Does anybody else know about that particular issue? Oh, sorry. I did turn my other mic on. On. Okay, all right. The handheld is better. No problem.
Okay.
So, can anybody else speak to this issue of payment income?
Well, the data actually was published on Medscape, and it's actually current as of last week. They differentiated by men, women, and as well as specialties. And what I get from that is that the federal government could possibly have a role in equalizing that pay, just as they did with the integration of the hospitals. But let me just first thank you for putting together such a wonderful documentary. It's a lesson in history for me, and because I'm from Mississippi, many of those people who participated, including Sylvia, I know her, but I know a lot of the people that were in that documentary, like Aaron Shirley and Robert Smith, and Dr. David Satcher, and Dr. Jack Geiger, who was at the Mount Bayer Health Center, and my cousin actually worked under him. But it's so informative. I'm wondering, have you distributed this to the National Medical Association? I'm just thinking the president of the National Medical Association would probably be willing to show this at our upcoming convention in Florida this year in last July.
I would love to get it shown at the National Medical Association.
It's so educational, and the important part is how the AMA came out against Medicare.
Oh, yeah. Yeah,
That
yes,
is
yes.
amazing to me.
And in fact, David Satcher, when we talked to him, made a point of saying that the reason that it's important to maintain the NMA, even though now the AMA has decided that they're going to let black doctors in, and actually issued a formal apology to both the NMA and black doctors, but not until, actually, I don't remember the exact date, but it was pretty late in coming. But Dr. Satcher made a point of saying that we need these organizations because they take different positions on issues that face American medical care. And that the NMA has always supported expanded coverage, and especially expanded government coverage, and the AMA has always opposed.
One last question. Do you have any route of distribution or any money for distribution of the film? Because I think it's historical. It colleges, universities in the healthcare industry.
I don't have money for distribution. I'm definitely looking for it. If anybody has any suggestions, please get in touch with me, or you can get in touch with UCLA, which will be happy to get in touch with me. The current, I mean, there are plans for distribution. It was actually streamed by American Public Television to all their member stations yesterday. And WLIW in New York, I know, is showing it tomorrow, as is WHUT, which is the Howard University station in DC. WETA, which is the main public television station in Washington, D.C., is showing it May 4th. And the North Carolina stations that are sponsored by the University of North Carolina are showing it first week in May. That's all the information that I have. Now,
Somebody should feel free to call or email KOCE here in Los Angeles and ask when it's being shown.
oh, yes, yes, it would be very helpful to get in touch with the PBS stations here, with
Yeah.
the PBS stations, KOCE and KCET,
Okay.
and ask them to put it on the air. Yeah, Frank.
Okay. Frank, then Shirley,
Barbara,
then Sylvia.
Barbara, excellent film, as would fit my classmate in the class of 72. It was very interesting for me to watch this because I know David Satcher and Jack Geiger, who were, Dr. Geiger was instrumental in setting up the neighborhood health center program, which is now called Community Health Center. 2,500 health centers established across the United States. We know the Venice Family Clinic, Northeast Valley Health Corporation, a whole bunch of them out here. But what I was thinking as I saw this was it was really quite good, and I think we should try to get it on HBO or Netflix. Or one of the PBS too, of course. And it was just an outstanding job. Thank you very much.
Okay.
Thank you.
Sylvia, and then back there, and then in from back there.
I want to just add my thanks for really an amazing historical document, which from a time that I lived through it. And I was so delighted to see Dr. Montague Cobb highlighted, because I worked for Dr. Cobb. He was a professor at Howard University Medical School when I was in college. I was his assistant on the National Medical Association Journal, and he said, Sylvia, tomorrow we're going to the March on Washington. I said, we are? And he said, yes, we are. I said, the newspaper said there's going to be a great deal of violence. He said, there'll be no violence. I'm going to meet tomorrow with Dr. King and the organizing committee for the medical part of the march, because there were a lot of physicians who came to the March on Washington. And he was in charge of organizing that, and met with Dr. King, and he took me to meet Dr. King about that. And he was, of course, an amazing person to meet in person. But he organized with other black physicians those Imhotep conferences, which were the organizing instrument for physicians about these problems. And people don't know about Dr. Cobb. They don't know what he did. They don't know how important a leader he was in the effort to desegregate hospitals. So thank you for highlighting his life and his role. And the medical school at Drew University is named for him, and it's called the Cobb Building. So if any of you come and visit, you'll see that it bears the name of Montague Cobb.
Great.
Can you write about your experiences for publication? It sounds like an amazing experience.
Well, I'm trying to write about the experiences of Charles Drew University, because it's the only HBC west of the Mississippi, and it really is carrying on the work, not only for African American communities, but for Latinos and other minorities nationwide, but specifically for the South LA community. So that's an important story that I'm working on.
Can you get the microphone all the way back there, and then you bring it into your colleague one row forward of you.
And please say your name and where you're from.
Thank you for the reminder. Yep.
Good afternoon, oh, good evening. My name is Darren, I'm from Global Care Medical Group. And I just had a quick 2 questions, actually. So I kind of wanted to know what was your favorite part about making the documentary, and what was the toughest part?
Oh, that's a really interesting question. I think unquestionably my favorite part was doing the interviews. You know, actually talking to people who had participated in the process and lived through the process. And the thing that it brought home to me, which I think is really important, is that, you know, people of color have always been asked in this country to trade their dignity and their humanity for survival. And this is just one example of that. And I think that that's really important and that we mustn't ever forget it. And of course, every time we hear about the talk that Black parents have with their, especially with their sons, but with their children, that's what it's about. You know, that it's about, this is what you have to do to survive in America. And we should take this very seriously and see what we can do to fix it. And the hardest part, I think in a way that the hardest part for me was maintaining my vision of what the film was supposed to be and, in a way, insisting on it. Since films are made with teams of people, and you have to convince all the other people that you have a vision that's worth putting on the screen.
Hi, I'm Ursula Bafiu. I'm a medical director with Ultimate Health Services. My area of focus, my area where I have my team is South Los Angeles. And I think this is not all in the past. I think it's still very much alive. We cannot find a pulmonologist in all of South LA. We cannot find a hand surgeon. Neurosurgery, they won't contract because of just the lack, first of all, the lack of specialists, and then because most of the people we serve are in Medicaid, Medi-Cal, they just won't contract with us unless it's significantly high rate. The only hospitals there, they're few and far between. A couple of the hospitals, they will not transfer patients back to the hospital, give us a bed when we have a contract with the hospital. So it's still very much alive. It's very much a struggle still. But I do, I appreciate, I think this is a very good film. But I do just wanted to reiterate that the fight's still on, and it's here in our backyard.
Yes, I think that's very important. The fight is definitely still on. That these, you know, we've made some progress, but we definitely have not solved the problem, and people are still organizing around it, and that's very important. It's very important that people continue to organize in this struggle for greater equity, for sure, and for greater access, for sure. I mean, you know, we know today that Medicaid and Medicare are both under the gun, and we have to do whatever we can do and, of course, get organized so that we can resist the efforts to push back these really vital programs.
Hi, my name is Rachel. I'm a policy analyst here at the School of Public Health.
No. That hardly constitutes an introduction to yourself. Say that.
Sorry, I'm a policy analyst at the World Center at the School of Public Health.
Thank you.
I had a question about the AMA and if they had any active opposition to future legislation that tried to give greater access to universal health care in the US. So I'm thinking mainly about the Affordable Care Act.
They actually, the AMA actually supported the Affordable Care Act.
So it wasn't just was it more of an opposition on universal health care or more about a segregation issue that they were opposing?
Well, I think, actually for them it was both, but I think that since Medicare, they have figured out that if you have insurance for everybody, that it means that everybody who walks into your office is insured, and that that's good for doctors. But it's interesting because in states where there have been fights about the expansion of Medicaid, that the state hospital associations have always supported the expansion of Medicaid. And the state medical associations, it's been much more iffy. In some states they have, and in some states they haven't. So, I would say the AMA is, to some extent, still a problem, but not, they're not, they don't oppose every expansion of access to care or every expansion of government insurance these days.
Hello, my name is Cecil Quincy, and I'm with Global Care Medical Group. I wanted to thank you for showing such an excellent film. Being an African American myself, I know that we face a lot of disparities within America and around the world. So this film was great. There's a lot of things that I learned. I didn't know that the AMA was never for Medicare. I did not know that, and there's a lot of other things that I learned from the film. So I wanted to know, is that a film that you're selling on a website, or can the public purchase this?
I am working on making copies available, selling copies on the website. I haven't figured that out quite exactly yet. As I said, it will be broadcast, and if you can make phone calls to get it broadcast by the Los Angeles market public television stations, that would be great. I'm sort of thinking that they'll pick it up, but I don't know that for sure. But is there a sign-in sheet for today? Yes, okay. So I will make sure that once I know how people can get copies, that everybody who's here today finds out how you can get copies.
More people need to see it, and I think a lot of people would think that it's very interesting, especially like Oprah Winfrey's network OWN, and then there's other channels that would be very interested in it.
Oh, okay.
Okay. Eric, did you have a comment you wanted to make on this point? And then I've got you.
Eric Wilkes. Hello? It's not working for me. Eric Wilkes with the School of Public Health Office of Development. Question I had for you is there seemed to be a wealth of material here that it could have easily extended well beyond the hour that you managed to get this film into. If you were to do a follow-up, or based on the wealth of information that you encountered, what would a part 2 potentially have looked like?
Oh, that's interesting. There were certainly a lot of things that I had to give up because, for one thing, public television, basically told us, you can do an hour show and we can get it on the air, and if you make it longer than that, we won't be able to. I think that I would be inclined to focus on two things. One would be what the actual struggle was like to implement Medicare and to get hospitals to comply with Title VI. And the other thing would be on the continuing efforts to expand equity and expand access to care. But I'd definitely be interested in, what any of you might have to say about what you think it would be good to have more of.
Hi there, I'm Brittany Urshay. I'm a soon-to-be graduating medical student here at UCLA, and I did a one-year MPH in the health policy and management track here. Watching this amazing video from the perspective of a current medical student, it was really astounding to me. We don't get a lot of social and historical context in our medical education. It's just not built into the curriculum. But we practice in historical and social context every single day.
Yes.
And having exposure to something like this, I think, would be extremely helpful for every upcoming doctor. So I was wondering if you are thinking about or planning on showing this video to not just public health students and people in the public health arena, but to medical students and nursing students as well.
I am going to try and find a distributor who will focus on medical schools, public health schools, nursing schools. But that's a really good suggestion. Thank you very much.
Okay. We have,
And I think that's true, that, we all suffer from not having enough historical context for the work that we're doing. One of the things that shocked me when I first came to this topic was that when I was at UCLA, and we did have a course that covered the history of Medicare and Medicaid, but it never talked about this, which I was quite surprised with.
okay. I think we've got time for about 2 more questions. So you, Abby, I'm going to give you the next to the last word. So 3. Go ahead.
Okay, well, I'll try to make this quick. My name's Travis West. I'm a union lawyer at Gilbert & Sackman here in Los Angeles. I actually went to law school right up the street here. I know you teach a whole class in this, and I know you probably don't have time to give a lecture in the next 5 minutes, but I was just wondering what goes in, from an activist as opposed to, a producer. What goes into producing a film like this? That, going from the idea and hearing some interesting interviews to producing a Netflix quality, let's say HBO quality documentary here. Or if there are any resources you could point me to, it would be.
Well, once I decided to do it, I started doing a lot of research, and there is actually a book that was written by one of the people in the film, David Barton Smith, that focuses on this topic. It's also called Power to Heal, put out by Vanderbilt Press. And then the process is very much a snowball process. You begin talking to whoever you know or can find out about. Like, I think I started by going to Jack Geiger, to Sylvia, and every time you talk to somebody and they tell you a story or stories, and you make sure that you ask them, who else should I be talking to? And they give you names, and you go and you talk to those people, and you get names from them, and that's a lot of it. So and I had some really amazing graduate students who were working with me, who were history graduate students who knew a lot about and learned a lot about this topic, and pointed me to issues, stories, people, a lot of that. I hope that answers your question.
Okay. Abby?
Hi, I'm Abigail Marx. I'm an actor, so very different than all of you. But I wanted to ask you to expand a little bit on your vision and how you set out to create the storyline of this. One of the 2 things that were really affecting were your synthesis of how the various administrations throughout time were trying to create forward movement, both in Medicare and health care in our country, as well as the civil rights movement, which ultimately, Johnson was the one who was able to affect it or begin it in earnest. So how did you create that arc throughout the piece? And then also, I was very affected by the visuals, and clearly some of those people gave you pictures of them, which was fantastic to be able to see them. But also, how did you procure some of that video footage and those images that are throughout the film?
Okay. In terms of the arc, when I came to the film, the piece of it that most captured me was the implementation of Medicare, which is really the end of the film. And then I came to realize that it wouldn't make any sense, that it didn't make any sense to talk about how Medicare was used to desegregate hospitals and what the actual process was like without providing this historical context, which absolutely had to do with the Civil Rights Act, because of course, if you hadn't had the Civil Rights Act, you wouldn't have had a basis for using Medicare to desegregate hospitals. And then some kind of history that looked at how did we get there. And I also thought it was really important to emphasize the really critical role that doctors, especially doctors in the South, played in the entire civil rights movement. Because they were critical, not just in healthcare desegregation, but in the civil rights movement in general, because as the film tries to point out, they could. You know, they had some economic independence, and they were acutely aware of this situation because, of course, it acutely impacted their lives as well as the lives of everybody that they treated and their whole community. And also because their community expected them to do this. That, you know, it was part of the trade-off. You know, we support you, we give you, you know, we come to you, we pay you, and what you have to do because of that is you have to push this issue. So I think those were the things that, for me, had to do with creating the arc of the film. And of course, you know, I wasn't alone in this. The director had a lot to do with it, as did the editor. In terms of finding archival footage, some of the photographs, we did find a lot from the people who we interviewed, and also from people that they told us about. And then I had several archival researchers who were looking for footage and looking for particular footage to illustrate specific things that were in the script.
I didn't introduce myself the last time. My name is Jessie Sherrod, and I'm a pediatric infectious disease specialist with a master's in health policy and management and a Robert Wood Johnson clinical scholar. And this piece of work is brilliant. And it's very special to me because I grew up with these people. I was in the civil rights movement, and I wanted to make the statement that oftentimes people who participated in the civil rights movement were referred to as being communists. And so the AMA, using the terminology that this is going to be socialized medicine, is something that was used against people who were fighting for equal rights. But my question is, and I want to say this about Dr. Cobb too. I got to meet Dr. Cobb as a medical student, and I thought he was the most brilliant doctor I've ever met. But with the corporatization of medicine, we also felt that the AMA let us down as physicians in the corporatization of medicine, and that the money was transferred from physicians to administrators who made decisions, were now making decisions about patient care with no medical training. So we felt the AMA let us down that way, and I'm wondering, it appears that we're getting farther away from equity, and now we have the private industry controlling everything. And so what do you think it's going to take now? We don't have the leverage of the federal government to get the equity that we need. And anything I can do to help you promote this film, I'll be glad to do.
Well, I think that you raise a really serious problem. Yeah. And that we've sort of missed a lot of opportunities to bypass the corporations. And I remember I used to say, that great sucking sound, that's the sound of massive amounts of money being transferred from the medical care system to the corporations that now, I don't know if you want to say run it, but certainly have a lot of input.
They run it.
So, you know, as for what we're going to do for a solution, I don't know. I mean, I don't know. You know, many people have proposed that Medicare for all is a solution, but I don't know. I think we have to think really carefully about that because the ACA has certainly not been a solution, and so it isn't. I think it depends very much on how you set up whatever kind of system that you set up and what roles you allow various players, including corporations, to play in it. I mean, I think that the notion, you know, when we first started talking about health maintenance organizations 2,000 years ago, we actually thought that, you know, these were going to be organizations that organized care, made sure that, you know, people had access to whatever it is that they had access to. You were talking about that, well, there's the pulmonologist, there isn't a hand surgeon, there isn't, you know, and that what the job of those organizations was going to be to make sure that everybody who was in there, or, you know, who was a patient, had access to those services, and not more what it seems like it is today, which is that these are just fiscal agents and the money flows through them and they get a cut. And, you know, they don't seem to do very much about ensuring that everybody has care. And I think that, you know, we have to figure out what is it that we need, you know, how are we going to organize healthcare in such a way that it's equitable, that everybody has access, and that, you know, and that everybody gets the care that they need. And I don't think that we've figured that out at all. I think there's plenty of models, you know, it's not like nobody else in the world has figured this out. But I think that it's a very serious problem, and we can't assume that it's just going to happen. And I think that you also raised this question. You know, the federal government is not, the federal government we have now is not going to move us in this direction. So we have to figure out what other vehicles there are for moving in that direction. You know, are they healthcare institutions? Are they state government? Are they, you know, how is it that we're going to move things until we have a better way of moving things at the federal level? I think those are all really important questions. And
Good.
we have to give thought to them, and we have to figure out organizations that we can use to move, to talk about those issues, to think about those issues, and to move.
So one of the last comments in the film was the battle is not over and the fight is not over and we need to continue. And your last comment sort of throws the question back at the whole audience as to how we move the fight forward to assure equity and access. So I want to thank the audience for participating, as this audience always does, in an incredibly interesting conversation. I want to thank Barbara for her film and her willingness to share it with us this evening and to share her reflections on it. The next health forum is, you will be available for a few minutes after, yes?
Yes.
So those of you who either were too shy to ask a question or did not get a chance, please feel to come down. The next health forum is on May 30th. Those of you who are paying any attention to that tax bill, and it required paying a fair amount of attention, might have noted that at the very last moment, the tax that created the mandate to buy insurance was repealed. So there is no longer a mandate to buy insurance. At the next forum, May 30th, here in this room, we will be having a discussion of what happens now that the mandate is gone. So it should be a fascinating discussion. I invite you all back. Tell your friends that they really need to be here, because this is where it happens on at least one Wednesday every month. Thank you so much.